How do I know which one to purchase? Well, we're not called hearing professionals for nothing. Rely on your professional. These days, with the internet so prevalent in our lives and all the answers to life's questions just a click away, many prospective candidates are researching and researching and researching until blood runs from their eyes. The end result, they are just as confused, if not more confused, than when they started. The professional has training and as importantly, experience with a variety of products, plus anecdotal data from patients that they work with. Anecdotal data is important because in my experience as a professional and user for 40 years, results are subjective from patient to patient. What may be working well for one patient may not be doing so for another patient with the same loss. Your professional has access to multiple brands and multiple technology levels within those brands and is best suited to make a recommendation based on your lifestyle, budget, and other needs like hearing better in noisy places or listening to music or TV. No matter what you purchase, you will see a dramatic improvement, but you must keep your feet planted in reality, knowing that hearing aids, regardless of cost or technology, are not a panacea for hearing loss. The instruments can only work with what's left of the ear to work with. You can't make something from nothing. With that said, once the step is taken to get help, you will be entering a rehab phase called oral rehabilitation, whereby the brain and ears learn how to work with each other due to the stimulus now being provided. Over time, word discrimination or understanding tends to improve, but it is not an overnight process. Some hearing loss problems can be mitigated by early intervention. The deterioration of the hearing nerves is unavoidable as it goes hand in hand with aging. This is called presbycusis. However, the symptoms of that deterioration can be minimized to some degree by obtaining amplification early on. Most people are not aware that they are developing a hearing loss because hearing testing is not part of their routine prophylactic health care. For the most part, people treat hearing loss as a social issue and do not approach it as a medical issue. Hence, the deterioration continues, the symptoms worsen until eventually the problem gets so bad that action is taken. Even those folks who are aware they have a problem choose to do nothing. If it doesn't hurt, bleed, or smell, folks ignore the problem. However, if action is taken early on, it will not stop the deterioration from occurring, but it will continue to present an important stimulus to the brain so that as the ears worsen, the ability to understand the spoken word remains elevated compared to a similar patient who has taken no corrective action. Like any other medical problem, the sooner you address the ailment, the better the prognosis.